now. There we go.
Okay.
Should be recording.
Okay, there are a couple people that are trying to get on and can't, so I'm sending them the other
Oh, great.
address, and let's see if we can make that work for them. So
Yeah.
go for it, and I'll try to do these technical deals here.
Okay, all right. So I'm going to go back to sharing my screen. And where we left off. Okay, so we were talking about ways to get involved or to cope in such a way that is true to your values. So I'm given some evidence-based activities that can be very helpful for coping during this time, which includes eating well-balanced meals, contacting family and friends virtually or via phone, email, snail mail, or text, meditating, even if it's just for 2 minutes, lighting an aromatic candle, keeping a gratitude journal. This is something that we know, and also I mentioned earlier some changes you can see if your brain was in the MRI. When we complete a gratitude exercise or actually list 5 or so things that we're grateful for, the activity in our brain changes areas as well. And so it is a known way to really reduce anxiety and help you improve your mood actually in the moment. You can also practice deep breathing, which we talked about earlier with the diaphragmatic breathing exercises. And then one of the things that is the most evidence-based treatment for feelings of depression or mood dysregulation is physical activity. So increasing your physical activity, especially if it's outdoors, can be very, very helpful. So you might want to engage in walking. This is a good time of year in that the weather is warming up, and with proper protection, personal protection, such as a mask, you are able to go outside with the baby and just practice proper social distancing rules. Also listening to music and limiting your upsetting social media exposure can be very helpful. You know, we're being bombarded right now with information that is changing daily or really by the hour. And a lot of that news is very sad, very worrisome, and it's coming nonstop at you. And so it's a good idea to really limit, maybe choose a time of day that you would like to watch a 30-minute newscast and limit it to that. Several people have also commented that Facebook and other social media sites have been very distressing for them. There's been a lot of increase in political arguing, increase in distrust for others, for the government, for medical professionals. All of these things can be very upsetting to people. And so identifying who is posting the things that are upsetting to you and perhaps silencing them for 30 days might be helpful to your overall mental health and wellness. And then we know that doing something kind for others, like I said, that can just even be sending a text message, maybe to your significant other or to a friend you haven't seen in a while because of social distancing, just saying how much you appreciate them in your life. Just that little action can really improve mood. And some other healthy coping ideas are listed there as well. When we're actually experiencing a significant amount of stress, my screen decided, there we go. Something that we can do that it's actually a skill taken from the world of DBT or dialectical behavioral therapy is to distract yourself with what we call accepts. So activities to keep your mind busy, some things that you enjoy, such as puzzling, drawing, writing, or listening to music. Contributing, helping others, right? Not making comparisons that are harmful, rather reminding yourself about the good things you have in your life. So we just mentioned that in terms of gratitude journaling. Doing something that you know will create a different emotion than what you are currently experiencing. So kind of also thinking about how to replace your negatives with positives. With pushing away, so pushing the experience out of your mind for a bit. Sometimes dealing with problems is easier and more beneficial after the initial storm has passed. And so kind of thinking of that drop anchor, get in the present moment with my senses, and understanding that how I will work through this problem or how I will handle this, I'm going to think about that tomorrow when I'm not quite as upset as I am right now. And then your thoughts, remembering that you do have more control over your thoughts than you may think. And then with intense, safe sensations. And that is, once again, those grounding exercises. So I mentioned the 5, 4, 3, 2, 1, but you can also hold some ice in your hand or take a cold shower. These are all ways to manage those distressing emotions that are difficult to tolerate. Back to our acronym, FACE COVID. The I stands for identifying resources. I've already given a ton of resources in my slides that have links, but I wanted to give you some phone numbers as well, including just calling 911. That is okay to do and important to do for the same reasons you would call 911 prior to the COVID epidemic. If you're worried about the wellness or safety or health of yourself, a family member, or your baby, and you need help and assistance, please call 911. Excuse me. You can also visit the disaster distress hotlines or helplines, and I've given 2 numbers there in which you could do that. If you're experiencing domestic violence in the home, which we unfortunately know there has been an increase in these types of circumstances since the epidemic began, please reach out for some assistance. I've given a number for you as well for that, for the National Domestic Hotline. And then there's also a great CDC document that I've given a link to for coping and managing daily stress and anxiety. And then last, the D in our FACE COVID stands for disinfect and distance physically. We know that we want to continue to remain social distancing from others outside of our home, and especially for our babies, who we are very unsure at this point as to what the long-term effects of a COVID infection might involve. So the best practices at this point is to remain masked in public and to practice social distancing policies and all of the proper disinfection, such as hand washing and using hand sanitizer. I ended the presentation with a gratitude exercise. I think that in those first few months postpartum, we know in some ways that we should be happy that we have this baby. And in many cases, we might be experiencing some disappointments or some additional worries about the baby. Are they eating enough? Are they sleeping enough? Are they growing properly? Does the baby have a medical condition that you're managing on top of all of this? And then on top of all of that, you're experiencing those worries and concerns in the context of a pandemic, where we have to do things like practice social distancing and limit our engagement with our social supports, which are so important to us during the postnatal period. But there are always things that we can think of that we're grateful for. And so I ask you to write down 5 things that you feel that you have to do, things that are responsibilities. So begin your statements with the words, I have to. So for example, I have to wash the dishes, or I have to pay the bills now, or I have to breastfeed, or I have to make 6 more bottles for tonight while I go to work so that my partner can feed the baby. I have to go to bed earlier because the baby's going to wake up around 1 a.m. And so I want you to make your list of things that may be bothering you, or just is just your daily to-do list of things you have to do. After you make that list, I would like you now, underneath the list, to write those same 5 things, but instead of using the words I have to, I'd like you to begin each statement with the words I get to. I get to do this. I get to feed the baby. I get to go to bed early because I have to get up and feed the baby tonight. Or I get to go to bed early because I get to get up and feed the baby tonight. notice how different it feels to think that you get to do something instead of you have to do something. It brings with it a whole different energy and a whole different perspective to every item on your list. And that's the power of the way you think, of how the way you think can impact how the way you feel. Okay? Sometimes those feelings, not sometimes, all the time really, for all of us, those emotions, those feelings, they come up. Sometimes they come from nowhere. Sometimes they're bubbling and we've been ruminating on them for days and weeks, right? But the one thing that we know is that none of them will last. Emotions are temporary. They come and they go. And as horrible as some of them may feel in the moment, one thing that you can hang on to, a truth that you can hang on to, is that they will not last forever. They will go. And so the grounding exercises that I gave you and the emotion and distress tolerance exercises that are in the workbook in the PDF that I provided, those are all ways to bring yourself back into the present moment, which will help those unpleasant emotions go away quicker. Okay? So I want to thank you and thank Kristen for inviting me to present today. I know that most people will be watching this via recording, and so we can't really do an open question and discussion, but I have listed at the bottom my name, which is once again Amy Graham. I am a doctoral student at Wayne State University and a health psychology intern at Henry Ford Health System. I will be a fellow there next year, and so my email is agram6, AGRAHAM6 @hfhs.org. I'm happy to send you any of the resources, the PowerPoint, phone numbers, anything that you may need, or if you are experiencing any thoughts or concerns that you think you'd like to talk to someone personally. I am not seeing patients at this time. I'm on a specific rotation at my internship, but I can point you in the direction of someone who is fully licensed and can see someone. And so I guess, Christina, I'll open it up, Kristen, to see if you have any questions while I get that tickle out again.
Thanks again, Amy. I really appreciate it. This will be posted on my Facebook page. Many of you, that's the way that you learned about our doula talk and signed up. So you will have access to this information, and we can start dialoguing on the Facebook page if you would like. And also, please do reach out to Amy. So again, I really do appreciate you taking the time, Amy, and I look forward to doing some more with you.
Thank you.
So congratulations on your dissertation, and I hope that it works out all that you want.
Me too. Thank you so much.
You're welcome.
Take care, everyone.
Be safe. Thanks.
Bye now.